Hi, my name is Gordy Hogue, and this is Community Connection. Each of us have stories that help us understand each other and help to bring our community closer together. I have been very fortunate to have met many interesting people who've had a positive, profound impact on our community and far beyond. People who've had incredible life experiences and fascinating stories. Community Connections is about these people and about their stories. I'm sure you'll enjoy meeting these amazing people as much as I have. Thank you. Please enjoy. Welcome to Community Connections. My name is Gordy Hogue, and I'm delighted to have today's guest. She's a woman who's kind of a legend in our community. She was a nurse here, ran an emergency ward at Peace Arch Hospital. She's retired, but she hasn't really slowed down a bit. She's full of energy and full of humor. She's on the boards of Hospice, the Hospital Auxiliary. Welcome, Kathy McIntyre.
Well, thank you, Gordon. That's quite the introduction. So I'll just start, I guess, in the beginning. I was raised in a very traditional family, mom, dad, 3 kids. The only thing not average about it was the fact that my dad was a banker. And so we moved all over BC. So in my 12 years in school, I went to school in Vernon, Cloverdale, Nelson, Burnaby, Surrey, White Rock, and Vancouver.
You moved around a lot.
We moved around a lot. It teaches you, at the time you think it's tragic, but it actually teaches you a lot of skills. Yeah. And of course, my time in White Rock was only 2 years, but there was just something about the people here and the community that really spoke to me. Right after grade 12, I graduated from McGee, and I went into nursing school at St. Paul's. So it wasn't solely my idea. I wasn't really following a passion. It was because my mother told me that's what I had to do.
There weren't a lot of options in those days, were there?
Well, that's right. And in those days, that you did what your mother told you to do. So 3 years at St. Paul's, in retrospect, an absolutely fabulous experience and wonderful training. We used to argue that it should have been called an education, but in fact, no, it wasn't. It wasn't broad, it was training. And so just like your sister Joan at the Columbian, you went to classes, you worked on the wards, and after your first 6 months, you had a cap and they called you nurse, but you really weren't one. I graduated in 1969, worked for about 6 months, saved a few dollars, and like everybody else in the 70s, headed off to Europe. So traveled with my cousin Sandy Whiteman and another friend. We even had the iconic Volkswagen van, and we made it as far as Istanbul, which was quite good because I think I left home with about $500. We worked in England for a while. It's the first time I realized that having been trained in Canada made you internationally quite acceptable. So we worked for St. Thomas's Hospital in London for a while and then came home. People always ask about your career, when you sort of, I don't think it dawned on me that I had a career till I was about 45. Because in those days, we were just working till we got married. Yeah. So I got married in 72, but lo and behold, I kept working, had 2 kids, kept working, worked at Peace Arch in the Emerge for a number of years. And then in 1986, I sailed off into the sunset and moved to Australia. Took my kids, worked and lived there for about 5 years. Gee, they call you sister. It's nice. They never have to know your name, they just call you sister. And that was a fabulous experience. But the one thing that you really miss is home and your family. So I came back here in about 91, and that's when it really started to dawn on me that I needed to kind of get my act together and do a bit of planning. So I went back to Peace Arch, fabulous job. We opened the 6th floor at Peace Arch with 30 medical beds and 10 palliative care. Well, I don't think I could even spell palliative care. But after working there for about 5 or 6 years, I think I learned more from palliative care patients and their families than I learned anywhere else in my career. And that was the time that I was invited to join the board of directors at Hospice. So that was about 93. And reconnected with Teresa Hotel, because of course I had taken Teresa's job as the manager in Emerge when she left to do her hospice work. So yeah, it's a small town. Up until that point, I really hadn't done any volunteering because I didn't have a lot of spare time. I worked a job or two and two kids, and so sitting on the board at hospice was my first introduction to volunteer work. But it was certainly part of my family growing up. Dad was always Kinsman, Kiwanis, Board of Trade. Mom was Red Cross, United Way. They were always very active volunteers. But I don't know when you started volunteering, but I didn't figure it out until quite a bit later.
I think I was about grade 11.
Oh yeah, no, I was a lot later than that. I was a late bloomer.
It was my mother
uh,
too.
yes, yes. Well, and you see, my mom was part of Peace Arch Hospital Auxiliary, where I am today. So small world. Once I retired from nursing, I had a lot more time on my hands, so it was uh, it was just a natural fit to get involved in the community. Because it's a funny thing to retire. You know, one day you're working 10 or 11 hours a day, and the next day you're just completely irrelevant. And I wanted to keep working and keep doing stuff. And I was fortunate to, at that time, join the board of directors at the auxiliary. And I again reconnected with hospice and joined the board of directors at hospice. So, and then I had the pleasure of working with Dr. Grace Park, and she wanted to establish a community based seniors health network and do some work to support our seniors in the community. So we did that. And through the Seniors Health Network, I met fabulous people at Seniors Come Share, Denise Darrell at Sources. And we were also fortunate that a number of our projects, because we were an unfunded community-based committee, a lot of our funding was given to us by the Peace Arch Hospital Foundation. So we ran, for 5 or 6 years, we ran a number of education programs and support programs for seniors that were funded by the foundation. So then I did some volunteer work for the foundation, which I still do today. It's really, you learn very quickly. I mean, in healthcare, you learn that you can't do anything without your team. It's very team-based, your care, whether it's in emerge or in general medicine or on the palliative care ward, it's all about that interdisciplinary team that comes together, because then you get a whole bunch of people, really smart people around the table, and you grow your ideas. And the very same thing happens in community. The successes we enjoyed with the Seniors Health Network were because of our partnerships and our collaboration. Because just on our own, we didn't have enough creativity. We were small. So partnering with the other organizations in the community and collaborating on events and education sessions for seniors just made a lot of sense. So that's the part I've enjoyed the most, is the collaboration. And also the fact that being on the board for both hospice and the auxiliary gives you the opportunity to kind of cross-pollinate. You can take ideas from one organization to the other and vice versa. And through that process, I think everybody gets a little richer. So that's been a very positive experience. I don't want to stop doing it either. I had to scale back a little bit when I was sick, but I don't want to lie down yet.
So when you look back on the many places you've lived and the experiences you've had, or some of those experiences stand out in terms of what influenced you to be where you are today and the volunteerism you're doing today?
Well, certainly it's my mom and dad and the contributions that they made. And of course, they were only in each place they lived for 2 or 3 years. That was the maximum amount of time. But it never took them very long to join community organizations and get involved. And so I think their influence was quite significant. And also in healthcare, I met a lot of people that influenced me a lot. And then just connecting with the organizations here in White Rock, you develop a great respect for the work they do. And they all do it with very restricted budgets. The recent COVID experiences certainly highlighted that. We've all had challenges raising money. And the only way we advance any of our programs is you need a bit of cash. So you need your fundraising to support the work that you want to do.
So the values that that you reflect in terms of the work you've done and the places you've been? Is there anything that stands out that makes our community seem a little bit different than some of the other
Yeah.
communities you've been to, and your travel when you were in Europe and going to Australia? Are there things that make our community different, our province, our country different?
Well, in Canada, and that's been highlighted through the pandemic, but also you realize that as a society nationally, we seem to care a lot more about the greater good than other places do. Doesn't make them bad or wrong, or it's just you really feel that here in Canada. And here in White Rock, it was always fun working with 4 or 5 different organizations to advance a project because of the level of cooperation and collaboration. You don't find that in every community. I know other places have struggled with, one organization wants to be in charge and they argue, but not in this community. That didn't happen at all. Everybody was always very engaged and supportive. We had hearty discussions, but left the room good friends. We put on an event here for about the last 4 years called For the Health of It. And we'd attract about 180 to 200 seniors on a Saturday. The city of White Rock very graciously gave us their community center. And we'd bring in guest speakers and have exhibits and have very engaging and participatory events. It was lots of fun, but it took a good few months of planning. But never during that process was there any conflict about who was going to do what, who was responsible, how it was going to be paid for. It was all very collaborative, and that was both not-for-profits and privates partnering on that initiative. And that to me sort of exemplified the kind of community we have. Everybody, for the most part, kind of gets along, and that makes a big difference when you're trying to achieve things.
Other than your mother and your father, are there other role models that you've come across in your time working in this field and in this community?
Other than yourself, you mean?
No.
Well, my cousin Sandy Whiteman and I, we traveled to Europe. I like to say to people, Sandy and I used to sleep together because, of course, we shared the back of a Volkswagen van for a year. Yeah. But Sandy's always been very engaged in any community he's lived in. He was in Terrace for most of his life growing up, then went to UBC and wound up settling here in South Surrey, White Rock. We unfortunately have lost him to Lake Country, but Sandy's always been very engaged. People like John Block. Yeah. John's very motivating because of his commitment and engagement and his belief in volunteerism. And I think the Rotary motto is perhaps one of the best, that says service above self. And anytime you get into trouble with issues in community volunteerism, it's because people are putting self above service. You see it all the time. But I was also quite motivated by Mr. Kish at Semiemo. Yeah. And a number of people that I've met through healthcare that have been motivating. Burl Gibbings was always motivating because she's just rock solid, right? She's got the good ethics, the morality, the belief in better way. Yeah, I liked her.
So in terms of healthcare and the integration of healthcare, the coordination that you talk about, the collaborative approach, where do you see healthcare in our community going over the next few years or few decades? The pandemic is certainly making people look at things differently, making us approach things differently. Volunteerism and the challenges that not being able to get together present. How do you see the next 25 years or more in terms of the issues of healthcare in our community? What are the important things we should be holding on to in terms of values? And then how do we reflect those in terms of where we go?
Patient and family in the center of every discussion related to healthcare. Has to be. That's why we're there. That's the heart of the work that's being done. So the patient and family need to be engaged and center of every discussion. Don't care if you're talking about budget, if you're talking about constructing a new facility, You need the people you care for in the center of the discussion. I think artificial intelligence is going to surprise healthcare. I think there's a little bit around already. I think that field will grow. We're a lot more technical than we were 30 years ago. I mean, I'm really old. We didn't have calculators. I used a slide rule in grade 12, which is one of the reasons I failed physics, one of the many reasons. But when you just look at the technical infrastructure that supports the work, the growth in the last 30 years has been outstanding. The growth in the next 30 will be even greater. Capacity will always challenge healthcare. Do we have enough beds? Well, there's a lot of thought around, is inpatient beds really what we need? I mean, look at the Jimmy Pattison Care and Surgery Center in Surrey. It's a big white building on a hill, but it's not a hospital. It doesn't have any inpatient beds, but it sees and cares for probably 3,000 or 4,000 people a day.
Wow.
And those are all people that were taken away or taken out of the acute care system, which is brilliant. Maybe we need more of that. I think even today, right now, with the pandemic, we're challenged by acute care capacity. But I think we need to think a little bit bigger than that, because if you only ever talk about that just grinds you down. You'll never have enough capacity. You got to make sure you got the right people in the right bed at the right time. And also in healthcare, you have a lot of different agendas to satisfy. You've got your long-term care patients who wind up spending way too much time in acute care, waiting for beds. You've got your whole surgical component, which is vital to so many people. It must be very debilitating to wait a year and a half to have your hip fixed. And then you've got the emergency department that is an open door 24/7. I think the challenges are huge. You asked me for answers. I don't think I've really provided any, but I think those are some of the, but I mean, when I was in nursing school, when we had patients having their cataracts fixed, they were in the hospital for about 7 to 10 days. And for the first 72 hours, they had to lie flat on their back with a sandbag at each side of their head to keep their head from moving. Wow. Now you walk into the operating room and you walk out and you go home, all within about an hour. Oh. So yeah, we've changed the way we care for people. And I think that kind of care will continue to evolve. We have a lot of people having their hip replaced going home the same day.
So there's also a bit of a movement of what's called hospital at home. And yeah. Is that something that, I'm not even sure exactly how that works, but I think it's trying to recognize that being able to treat people in their homes to the degree that we can and have that level of service, therefore freeing up hospital beds for more emergent care, but also being able to, is that something that I think it's just a bit of a pilot around the world. Have you heard much about that, and any thoughts how that might work?
Yeah, they ran a really good program here through the Division of Family Practice, where they had a visiting doctor and nurse practitioner, and they would go out and see people at home who were challenged to get to the office because of physical limitations or transportation or a variety of reasons. And that was an excellent program. I'm not sure if it's still running, but I know they were seeing 3 or 4 people when they would go to Whitecliff, which is right next door to me here. And one of them was an aunt of a friend of mine. And it was just a fabulous service for her because she didn't drive. She had mobility issues. And so to get her to a doctor's office involved a lot of work and a lot of people. And quite often it was just a checkup and prescription. There's a lot of pharmacies in the community that will deliver your pills to your house. They'll even send a nurse around to give them to you. So yes, Gordon, I think there are lots of opportunities for providing more at home. But I also think our community healthcare, our home care nursing and community infrastructure isn't robust enough yet. Because if you're waiting for a caregiver to come at 2 o'clock so that the caregiver can take care of your husband and you can go to a medical appointment of your own, that caregiver's got to be there at 2 o'clock, not 3, and not be unable to come today. You know, we need a more robust system in the community that works all the time. because you hear about a lot of people who it doesn't work well for. So, and where do you get the resources from that for that? You can't. People always think if you get some of those kinds of people out of the hospital, then you can move some resources from the hospital into the community to care for them, but you can't, because those beds in the hospital just fill up again. Like increasing your throughput in the hospital and getting your patients moved out of emerge and getting them upstairs more quickly and getting people home sooner, that doesn't save money. That probably costs more because you just increase your throughput in the same number of physical resources. So
the role of the nurse practitioner too, can that be expanded in terms of the demands that puts on the family docs and the
it's expanded significantly in the last 10 years in BC. Some provinces in Canada are a bit ahead of us, but yes, the nurse practitioner can extremely well manage a volume of, a couple of hundred people out of her office. And she can do diagnostics, write prescriptions, very thorough investigative work. There's very little that she can't do, he or she. So yes, I think there's a very big role for nurse practitioners. And you can also put, which they've done here in White Rock, South Surrey, put a lot of nurses into the doc's office, and that nurse can enable a lot more work to be done. She can run a class of 5 people for congestive heart failure. She can teach the patients with diabetes how to better care for themselves. I think there's a really strong role for the nurse in the office, and that's an RN. And then the nurse practitioner is an independent practitioner. She runs her own office. We have a primary care clinic here in White Rock that has nurse practitioners, and it's a fabulous clinic. And they have a doc who practices there, and then a couple of nurse practitioners, and they do some work together and then some independently. Yeah.
You've talked about your mom and dad and how they were your role models growing up. Can you talk a little bit about your family now and how you provide that type of a mentorship and role model for your children and grandchildren?
Well, I'm not sure I'm a role model particularly, but I think both my adult children are strong and independent, and they both value community and what it takes to be part of a strong, connected community. The grandkids are 10 and 12. They're a little bit young yet, but they had a lot of trouble understanding when Grammy retired that she kept going to work. Yeah. Because they'd say, well, how come you're going to those meetings? I thought you retired. Well, yeah, I did, but now I do other stuff. That's the other joy in retirement, is you can pick and choose what you want to do. It's not like work where you sort of did everything that came your way. Now you can say yes to this and maybe not to that. So that's kind of nice.
Throughout the many roles you've played, both working in volunteerism, and you've always had at least appearance of a positive, humorous outlook on life, while it's very engaging. Is there something about you that allows you to do that? How do you get that sense of being able to be positive and at the same time be able to be stern in specific issues? You seem to have a wonderful blend and personality in terms of doing that. Is that something that just came naturally, or is that something you work on or spend time with?
No, I think it's, I don't know. It's just something that you develop over time. It's like a lot of things you become because of your environmental circumstances, the nature versus nurture. I had a lot of influence from my parents, but also just the way my life unfolded. You don't really have the opportunity when you're a single mom with a couple of kids to, lie around and whine. Yeah. And funny, it never did any good either. So, and I think that's an important thing to teach, and you probably teach it through modeling, is that, life wasn't meant to be fair, and it is what it is. Make the best of it. And if you don't like the direction that your life is going in, change it. I realize that's maybe unfair for people who aren't able to, but even with limited skill and resources, I was able to a couple of times change gears. And that's actually what I had to do in retirement, because I didn't really plan anything. I didn't think about a transition plan, or as I would have with any project at work, I didn't see myself as a project. And all of a sudden I was retired and went, oh my God, now what? So then I had a couple of really nice opportunities and connected the dots a little bit. And yeah, it's been great.
So through the course of your lifetime, if you had some messages to pass on to people, just new people coming into nursing, people coming into the community, what would those messages be? What do you think are the things you'd like to pass along to those people who are starting out in the community, volunteering, and particularly starting out in the field of medicine and nursing?
Wow. Be clear about what your values are. Stand up for those things, the things that are important. Get along, get along, get along. We used to get a lot of nursing students when I was at work, both student nurses and new nurses. And you could always say to them, look, your success working in the emergency department will be based partially on your skill and ability, but more so on your ability to get along. So if you can develop and sustain relationships, if you can sometimes, a lot of times, put your needs on the back burner and put others' needs ahead of yours, and give quality patient care. Those are the things you need to really focus on if you're going to be successful. And being flexible. I think the Emerge taught me that, because no day in Emerge is ever like the day before. Every hour, every half hour, the situation changes. So what was the most important thing to do 10 minutes ago is no longer the most important thing to do. And it's hard for people who are rigid to work in that environment, because you have to be really flexible.
Yeah, probably those messages you give about getting along and cooperating and collaborating with people are probably don't apply just to working in nursing. They're probably pretty good messages for living, for getting along in community, to getting along in a family, and growing with a community.
And to learn to respect where other people are at. You learn that in nursing, because everybody who comes into the emergency department probably didn't plan on being there today. So respecting where they're at, you use the same principles in education, meeting the learner where they're at, and listening and being sensitive and intuitive just to what's going on for people. And that's the same in any workplace as it is in nursing, but it's just more pronounced in nursing.
Yeah, more upfront. And I guess in many ways, it's what it is to be a citizen, what it is to be a participating citizen in a society.
Well, and that's exactly right. And when you work in the community, you see people of all ages, all ethnicity, and all circumstances. So everybody comes with a story. And, taking the time to listen to people's stories and appreciate where they're coming from, instead of always pushing your agenda, is will serve you well. Yeah. And that's an interesting skill. I'm working with a group of students at the moment from Kwantlen University, and I'm involved in a program it's being funded by the foundation, and it's Move for Life. So it spans all age groups from elementary school to seniors. It's connected to Sport for Life Canada, and it's looking at physical literacy. So the students are working with us, but they're coming to they were until COVID, coming to the Center for Active Living and working with a group of seniors doing a program called Exercise for the Prevention and Management of Chronic Disease. Because the literature suggests that exercise is medicine. Exercise is a great way to manage the symptoms of multiple chronic illnesses. So the students are coming there, but they're only, I think they're first year students. And their only role there is really to talk to people. the objective, and I don't remember ever having a program like this when I was at St. Paul's, but the objective for them really is to enhance their communication skills. So it's teaching them to listen to people's stories, to appreciate where people are coming from, to develop their skills of observation and communication. And that's just so essential. Um, I mean, there's a wonderful story about a nurse in Emerge, a junior nurse, who was learning how to do triage. And triage is it's quite a senior skill. And she said, you know, the nurse I'm working with is senior, and I look at the lineup of people waiting to register, and they all look the same to me. But the nurse I'm working with can pick out the guy fourth back in the black hat and say, bring him to the front, he's sicker. How does she know that? Well, that comes from years and years of observing human behavior and years of seeing clinical presentations. And so a really astute senior nurse can pick out a sick guy from 20 paces, but a junior nurse can't. She hasn't developed that skill yet. So these nurses coming to the Center for Active Living are starting to develop those skills and starting to understand human behavior and how people experience their health and wellness. And that just takes a lot of time to develop. Well, you know that. You know, I mean, look at the people you talk to and the judgments and assessments you make just in conversation.
And I think the value behind that is empathy. And if you have that empathetic approach, then your ability to start learning that skill becomes much more a part of you because of the value that is inherent.
And how do you teach empathy?
Yeah, and a lot of it comes out of your upbringing, the things that you've learned through before you even learned how to talk. Probably the first 3 years of life are so crucial in terms of some of those judgments, and then it's much harder to learn later. But I don't think it's ever not possible to do it.
So you think empathy is teachable?
I think an understanding, an appreciation of other people is always can be. We can all get better at it at whatever level we might be. So whether or not you'll ever get to that empathetic level of Gandhi, but certainly being able to be able to have a better caring for somebody that's close to you, being able to have that type of empathy, I think, and that's part of I think the optimism that we have to hold on to for living in a society that there's always a chance that we can do better, that we can understand better, whether it's individually or collectively.
Well, I can't tell you the number of times I have thought I'd like to go back and practice nursing now, knowing what I know now compared to what I knew then. I made some mistakes, you know.
Pardon
me?
We've all made mistakes, and I'm afraid we will all continue to make mistakes, but unless we're trying, then we're probably not learning, and we've got to be stepping out and making those efforts.
And that's one of the reasons that I continue to do the volunteer work, is because there's so much more to learn. And if you stand still and stop learning and growing, then you kind of rust or something, don't you?
Rest or rust?
Rest or rust, that's right. That's right.
Yeah. And hopefully that we spend all of our lives contributing in one way or another to others who are close to us and more broadly to our community.
Well, and you hope when you talked about, you know, role modeling for your kids and grandkids and stuff, that's something that you hope you pass on. I don't think we ever sat down and talked about empathy, but I think both my kids have it and have an awareness of other people's situations, and makes you a lot less judgmental, doesn't it?
Yeah, and I think we learn about life by doing, not by reading and learning. It's all about doing and experience through that.
Yeah. And that's why I've been fortunate to be able to do quite a bit of traveling in the last few years. And you get the opportunity to see other cultures. I mean, it drove me crazy in Thailand because they just had no regard for safety. But by God, they love their children.
Yeah.
You know, so you get to appreciate the good things in a culture, and the other things. It's just like India, where they, you know, still throw garbage on the ground. But they're just a few years behind the rest of the world. They'll come right. Because there again, you can see absolutely loving relationships with their kids and families. They take care of their grandparents until they die. They have wonderfully strong families. And yeah, that's a joy in traveling, is getting to see other cultures and other families and how they behave.
And I guess in some ways seeing the sameness that exists all over the world, where most people care about family and community, and in some ways trying to make a better life, being able to contribute more, whether that's emotionally or spiritually or economically, and being able to share that in so many ways. And I think there's a common link throughout the world around some of those values.
I think challenging teenagers, I think that's pervasive in every culture.
Yeah.
It was in Africa, in India, in Turkey, it was everywhere. Yeah.
So Kathy, this has been wonderful. Thank you very much. Are there any parting words of wisdom or joy that you'd like to provide for our listeners and our watchers?
Just don't lie down. Just keep working, stay engaged, stay socially and intellectually connected, and continue to learn.
Thank you so much for being our guest. Thank you for joining us today on Community Connections. Please tune in to our next show as more amazing people share their wonderful stories. If you haven't already, please click on the red subscribe button below, right down there, and view our updates. Feel free to leave any thoughts or comments that you may have. We're always trying to do a better job of connecting this wonderful community. Thanks again for joining, and until next time, keep connecting. Thank you.